Health and Pandemic. Since February 2020, this segment has been unique in America, answering your LGBTQ plus community questions about our unique health needs. We are proud to have Queer News Tonight health anchor Dr. Howard Grossman.
He is an American pioneer in HIV/AIDS medical treatment and was the executive HIV medicine. He is a nationally recognized medical expert and proud member of our LGBTQ plus community.
Well, good evening, Dr. Grossman. And before we move into the viewer questions that we have tonight, I want to ask you about your thoughts over what you've seen in this week's health news for our community.
Well, thanks, Al. I would...
you could raise our volume a little.
Can you hear me?
Yes, can. Go ahead.
Okay. So this morning's New York Times had a very important article I think everybody should try regarding the real risk of the Delta variant for vaccinated people. I think we've talked for some time about the fact that the media tremendous hysteria when in fact we're talking about relatively small numbers of people. And several studies that they quoted found 1 in 5,000 cases for somebody to get reinfected in places where levels were very low, and in places where vaccine levels are higher, wasn't, or even less. And so, we've talked about the fact that hospitalizations are rare for people who have been vaccinated, more reassuring. So that was the New York Times this morning.
Howard, I want to ask you, that's interesting news, and I'm going to read that. I haven't read that yet. Thanks for bringing that to our attention. I want to ask you, but any thoughts yet on this new Mu variant?
Oh, we're up to Mu, are we?
Yeah.
I read about it.
Yeah, it's just breaking.
Yeah, as long as people don't get vaccinated, the virus will continue to mutate as viruses do. If found and stop spreading, it's going to stop mutating.
Yeah. Well, we've got we have some questions for you tonight into tonight's questions.
A doctor in Tampa is refusing to treat unvaccinated patients in person. What are your thoughts on this?
Well, I think every person needs to think about his or her own risk or their own risk and act accordingly. And if for whatever reason this doctor feels at increased risk, I think that's legitimate. On the other hand, many healthcare providers are angry about people who aren't vaccinated. And it's really not a matter of risk, but it's a matter of anger. And you can't get angry at people for being stupid, and you can't get angry at people for taking health risks in a medical setting. So, we treat smokers when they get cancer, and we don't get angry at them. There was a period in the early days of AIDS, we really didn't have treatment, but we first had PCP prophylaxis, prevention of pneumocystis pneumonia. And there were doctors who said, I won't take care of anybody who doesn't do PCP prophylaxis, because they were so burned, and here was finally a tool to keep people alive, that was their reaction. And I just don't think that's the way to do it.
Howard, I want to ask you on that, and other people have asked me about our segment that I do with you, and I want to zero right in just very briefly on that point. Are you seeing similarities, because I didn't see it in this perspective in the 90s, are you seeing from your early days of dealing with AIDS and HIV, are you seeing similar tracks of the way healthcare professionals are responding and the community is responding to AIDS, HIV in those days and the unvaccinated today? Do you see a common track?
I mean, forget about those days and these days, Al. I just had a patient the other day whose primary care doctor wouldn't prescribe PrEP, so he came to me to get it. And then when he called the doctor and said, I need a referral to see this person who's a specialist so that he can get paid, the guy basically kicked him out of his practice. He said, I told you that I don't believe in it, and I don't believe that it works, and so if you take it, I don't want you to be my patient.
Okay, bye.
Okay. Yeah, right. That's what the guy said, but the patient said. But that was the in 2021 here in Florida. So, we certainly saw AIDS denialism. We saw people who refused to believe that a virus could do these things. We saw, and literally the AIDS denialists in South Africa were responsible for literally millions of deaths. So this kind of thing is not new. What's new is that we have the internet, and the internet has created this feeling that people can be their own scientists. That people can actually say but I love the fact that people get onto a machine that can fit in the palm of their hand, that works over wireless things through towers all over the place, and then they say, "Oh, I don't believe in science."
Dr. Grossman, I want to publicly state that I am copywriting that phrase right now. I'm going to put it on shirts. I am my own scientist.
Yes.
I have Google. I can find out the answer myself.
Yes, exactly. Keisha, let's talk about an international question.
Of course, you got it. A man in Vietnam was sentenced to 5 years in jail for lying on health paperwork and spreading COVID-19 to 8 people, one of whom died. Is this similar to AIDS criminalization?
I think it's very different because clearly this is a person who lied about their status and put other people at risk. And I think that there is consensus that people who there have been a very rare cases of people with serious mental illness problems who purposely go out and infect people with HIV. That's very different from the HIV criminalization that has made it that even though someone can't pass the virus because they're undetectable, if they don't reveal to everybody around them that they're HIV positive, they somehow could end up in jail for 20 years. That's what HIV criminalization did in the U.S. It has no basis in science. This isn't about people purposely going out and infecting people. It's based on prejudice against people living with HIV. Period.
Mm-hmm.
Awesome. You're sick with a virus that you could infect people with, and you go around infecting them on purpose. That's pretty serious.
Yeah.
Agreed. I have another question. So first responders are dying in higher numbers than the general population, yet are pushing back against vaccine mandates. Why do you think this is happening?
That's one of the big mysteries out of this. I noticed that there were 3 police officers, I believe, who died here in Broward County in the last couple of weeks. There's no mention in the papers of whether they were vaccinated or not, but you can kind of assume that they probably weren't. Why there are all these nurses who won't get vaccinated? I heard a story about a nurse at a local university, working in a transplant unit, who refused to get vaccinated and infected all the people in the transplant unit, many of whom died.
See?
I don't understand how these people can consider themselves public servants. But you hear it across the country: police officers not getting vaccinated, firemen not getting vaccinated, and then medical personnel. That's the biggest one to me, the mystery. It's this denialism, and it's also, I think, this whole idea that somehow it's a political litmus test whether you get vaccinated or not.
Yeah, it is politics, isn't it? It really does. A year and a half of this, and it comes down to what political party or what you support. Unfortunately, get vaccinated. Period. Get vaccinated. All right. Well. That is this evening's Queer News, tonight's Q&A on LGBTQ plus health and the pandemic. We're here every Tuesday with Dr. Howard Grossman. He and I are having an affair, by the way. It's same time next Tuesday.
Telefair. It's a telefair.
Yeah, exactly right. It's as intimate as we can make it, considering we. So we remind you: do you need medical assistance? Of course, we're the LGBTQ community, and we do. So we are Howard Grossman here in Wilton Manors and all across South Florida. And thank you again, Howard, for being with us and on another date with me on a Tuesday night.
The rest of your friends, too.
Yes, exactly. LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth